Distinguished experts, it's a great honor to attend the International Conference on Oncology and Cancer in the category Best Research Award. I'm Shuanglin Qin from Hubei University of Science and Technology, China. My topic is Best Indoor Natural Products, a vital source for the development of new anti-cancer drugs. The World Health Organization points out that 1/5 of the world's people will suffer from anti-cancer in their lifetime. Malignant tumors are also the second leading cause of death in the world. Therefore, in addition to the requirement of cancer prevention, the top priority is still to seek effective treatment for cancer. At present, chemotherapy is the main clinical treatment for cancer. Although it inhibits tumor growth, it has many side effects such as kidney or liver injury, myocardial cell contraction dysfunction, blood coagulation abnormality, serious gastrointestinal reaction, neurotoxicity, alopecia, and so on. With remarkable changes in the landscape of cancer therapy and the growing role of cutting-edge technologies, we are facing an unprecedented opportunity to better understand natural products and explore their therapeutic utility. Natural products with remarkable chemical diversity have been extensively investigated for their anti-cancer potential for more than a half a century. For us, the focus is the natural products of Bisindole. Indole is a heterocyclic compound with multifunctional active pharmacophores that widely exist in natural and synthetic bioactive compounds. Bisindole, where two indole molecules are indirectly linked or directly polymerized, leading to the diversity of structure and mechanism and the better anti-cancer activity than monomers. Monomer dimerization has the potential to enhance biological activity, reduce side effects, overcome drug resistance, and improve pharmacokinetics, pharmacodynamics, and physicochemical characteristics. Vinblastine and vincristine are Bisindole agonists with strong anti-tumor activity, and vincristine is currently used as an anti-tumor drug in the clinic. It is worth mentioning that the anti-tumor effect of the monomeric compound named Vindoline and cancerseason is much lower than that of vinblastine and vincristine. Thus, the dimeric indole structure is the key to their anti-tumor activity. Bisindole agonists 5 to 19 are linked by imidazole and carbonyl imidazole. Compound 5 to 7 with 2,4-3 indole imidazole skeleton was isolated from their Wolf's response. Compound 5 to 7 had significant inhibitory effect on P338 cells with AC15 of 7 and 1.7 microgram per millimeter, respectively. Its analog compound 8 also inhibits P338 cells. In recent years, several analogs of compound 8 have been synthesized with different anti-tumor activity against different cancer cells. Compound 9 and 10 were isolated from the Mediterranean spawn. Two indolines were linked by carbonyl imidazole. Compound 9 and 10 exhibit a moderate anti-proliferative activity against NSCLC-N6 with AC50 of 12 and 6.3 microgram per millimeter, respectively. The cytotoxic effects of compound 9 and 10 on henna cells were also reported with AC15 values of 4.4 and 1.7 micromole per liter, respectively. Researchers have isolated compound 11 from spawns. Compound 11 shows the strongest inhibitory effects on murine P388 cancer cell lines with an AC50 of 4 micromole per liter, and a moderate inhibitory effect on human HL60 cancer cell lines with an AC50 of 50 micromole per liter in vitro. In vivo tumor models were established with P388 tumor and B16 melanoma inoculated in male CD2FL mice and female B6D2FL mice, respectively. Compound 11 had a certain inhibitory effect on P388 and B16. Further studies on P388 cancer cells revealed that compound 11 inhibits DNA synthesis and RNA synthesis, and protein synthesis were not affected. Compound 13 to 16 showed a moderate inhibitory effect on AGAs. Compounds 13, 14 showed moderate inhibitory effect on BC cancer cells. Compound 13 showed moderate inhibitory effect on HepG2 with AC15 values of 3.3 microgram per millimeter. Compound 15 has also been demonstrated to be cytotoxic to P388 cells with an AC15 of 7 microgram per millimeter. Best interactinoid 20 to 36 are linked by polymerizing ketone. Compound 23, 24, 28, 30, and 35 showed a moderate inhibitory effect on AGAs. Compound 24 showed moderate inhibitory effect on HepG2 with AC15 values of 12 microgram per millimeter, respectively. In vitro cytotoxicity tests, compound 34 revealed its AC15 value of 14 micromole per millimeter against P388 cells and 1 to 10 micromole per liter against A500 for 49 HCTH and MDAMB. This is best interactinoid linked by other structures. Compound 37 was isolated from the new Caledonian spawn origin and was highly cytotoxic against U973, MCF7, and cargo-2 cancer cell lines. The mechanism of action of compound 37 was firstly investigated in the U937 tumor cell model. Studies have shown that compound 37 regulates the ratio between anti-apoptotic and pro-apoptotic factors, induce mitochondrial involvement in apoptosis activation by the downregulation of BLC2, BCLX, and upregulation of BAX, and thus promotes apoptotic U937 cells. As a specific CDK4 inhibitor, compound 38 significantly inhibits NSCLC and SCLC cancer cells activity and directly affects the transcription of DNA and various proteins. Compound 38 can kill glioma cells and dose above 0.5 micromole per liter and inhibits the growth of multipotent tumor cells. Compound 38 suppresses cell proliferation and promotes apoptosis of human ovarian cancer cell lines A2780 and OVCAR3 by decreasing protein expression of CDK4, cyclin D1, BCL2, and VEGF. It may induce the apoptosis and increase the sub-G1 fraction along with apoptosis rate of melanoma cells in vivo and vitro. Gene team has isolated a new cyclopentadienyl actinoid 39 from a cartridge spawn. Compound 39 was highly cytotoxic to K562 tumor cell lines and an attractive DAO inhibitor of Wnt and HIF1, with strong inhibitory activity and 5 micromole per liter that is positive control. The AC15 values of compound 40 detected by PEC1, MIA, PECA2, BXPC3, and ASPC1 cancer cell lines were 18, 26, 14, and 27 micromole per liter respectively. It has been demonstrated that compound 40 and 41 were moderately cytotoxic to henna cells with AC50 values of 4 and 4 micromole per liter respectively. Compound 42 and 43 without circulation between two indolines are isolated from enriched spawn. The cytotoxicity of calciamide B on henna cells were determined for 6 and 24 hours after incubation with AC50 of 165 and 146 micromole per liter respectively. Its AC15 was higher than that of calciamide A. The study showed that compound 44 to 47 had a moderate inhibitory effect on A549 and K562 cancer cell lines with an IC50 range of 24 to 77 micromolar per liter. Compound 48 and 49 was less active. Compound 56 and 57B were cytotoxic to MCF7 with SA50 value of 32, 31, and respectively. Compound 57A was cytotoxic to HCT 116 cells with an SA15 value of 78 micromolar per liter. Indirubin has been used for the treatment of human chronic myeloid leukemia for more than 20 years in China, with also Henders-Lewis lung cancer and Waco carcinosarcoma 256 with only mild toxicity in animal models. The inhibition of indirubin on overall cancer was revealed to the STAT3 signaling pathway. Coumadin B2C had obvious cytotoxicity, and negative coumadin B was more toxic to HEP3B cells than its initial positive coumadin B. Further studies show that these compounds lead to the death of HCC cells by inducing apoptosis. Compared to positive coumadin B, negative coumadin B induced more apoptotic cells and the same concentration. These results indicated that they had the potential to develop novel anti-liver cancer drugs. Bisindole 61, 62, 68 significantly inhibited in vitro growth of a series of human cancer cell lines, including KBS, KB, VJ, 300 PC, 3 MDAMB, 231 NLNCAP, MCF7, HT29, A549, and HCT116 cells with IC15 value of 0.0125 micro per liter. Notably, Bisindole 65 can be used in combination with anti-cancer drugs like gemcitabine as a new therapeutic strategy. Bisindole 69 was significantly cytotoxic to series of cancer cell lines, including MCF7, SMMC 7721, HL16, SW480, and A549 with IC50 range of 0.1 to 5.7 micromolar per liter. Several new Bisindole diagnoses, such as compound 70 to 75, was explored against SMMC 7721, HT29, and A549 tumor cell lines in vitro. Except compound 72, the other compounds were toxic to the three tumor cell lines. Compounds 76 and 77 were cytotoxic to A549, HepG2, and SGC7901 cancer cells by inhibiting NF-kappa B signaling pathway. Compounds 77 and 78 could inhibit in vitro growth of a series of human cancer cell lines, including KBS, KBVJ, 300 PC3, and so on. MTT analysis shows that 79 exhibits cytotoxic activity against A549, K562, PC3, and BT549. The IC50 value were 11, 10, 3, and 0.89 micromolar per liter respectively. And its cytotoxicity against BT549 cells were the most significant. Further studies show that it induced apoptosis by activating caspase-3 and P53 and down-regulating BCL2, thereby inhibiting the proliferation of BT549 cells. The Shi team firstly reports the isolation of compounds 83 and 84. The compound 83 had moderate cytotoxicity cytotoxic activity against SMMC 7721, HANA, HepG2, and A549 cells with AC50 values of 4, 4, 7, 16 micromole per liter respectively. However, compound 84 show no significant cytotoxicity and 40 micromole per liter. The new compound 86 and the no compound 87, 88, and 89 could moderately inhibit the HL60, SMMC 7721, A549, MCF7, and SW480 cancer cells. Among them, these four compounds had the most significant effect against HL60 cells with AC50 of 30 to 50 micromole per liter. Compounds 90 to 97 with two Bisindole units connected by spiral heterocycles were performed on SKMEL28 SW480 HepG2 T47D A549 and MDA MB231 compounds. Compounds 90 to 93 showed cytotoxicity against some cancer cell lines with AC50 of 2 to 9 micromole per liter. The cytotoxicity of compounds 94 to 97 on HL60 RPMI 8226 NCIH 226 HCT 116 and MCF7 cells were identified with different degrees of cytotoxicity. Among them, the cytotoxicity of compounds 94 and 97 was significant with AC15 of 0.5 to 2 micromole per liter. Compound 219 DIM has an inhibitory effect on various cancer cells. Clinical trials of DIM for prostate and breast cancer have been completed. DIM can inhibit cell proliferation of colon cancer in vitro and in vivo. DIM inhibited the proliferation of colon cancer in vitro by inhibiting the expression of COX-1 and 2 or ERK1 and 2 protein. Moreover, DIM can inhibit PGE2 production and phosphorylated RSK expression in the colon cancer cells. Compound 220 showed moderate cytotoxicity against HepG2, HEP2, HCT 116, and MCF7. The anti-proliferation activity of 220 might be related to its inhibition of tubulin polymerization. For reasons of time, I regret that I cannot present all the contents of our article. In a word, 242 Bisindole natural products show different degrees of anti-cancer activity. The dimeric indole structure acts as the crux to Bisindoles. Bisindoles provide a variety of leading structures for novel anti-cancer drugs. In our recent studies, we have completed the total synthesis and the structure activity relationship studies of R6-dibromohamarcancer A and calciamide A. The data is being collected and published. I hope I will have the opportunity to report to you again in the future. Here, I would like to thank the partners and the various funding support. Finally, I would like to thank once again the experts who prepared the meeting for the endorsement and invitation. Thank you.